Hey, what's going on? I'm Dr. Leila Hariri, a family and cosmetic dentist for more than 22 years. And you're listening to Ask Dr. Leila. Anything you need to know about dentistry. We're going to talk about teeth, prevention, oral health, and tons more. So relax, listen, and smile. A very good morning to all of you out there. It's October, and that's Breast Cancer Month. Let us join together as always. Prevention is better than cure. So to all the ladies out there, please step up and rise and do your checkups. And on to today's podcast. It's about night guards, and especially night guards if you've had any cosmetic work done on your teeth, such as veneers. Porcelain veneers are a wonderful investment in a beautiful smile. And here at the Leila Hariri Clinic, we have created thousands of designer smiles using porcelain veneers. It is our goal that any cosmetic dental treatments we perform provide you with many decades of a confident and naturally beautiful smile that you will love. Just like any significant investment, maintenance is required for long-term success. So what does a night guard do? Night guards come in all shapes and sizes, materials, and manufacturers. You can find them over the counter at your pharmacy and grocery store, or you can receive a prescription for a custom-made appliance by your dentist. While some night guards have unique designs to meet specific requirements, in general, they all function to perform some important purposes. But of course, if you ask me as a dentist, I much prefer to have the customized night guard. That I take the impression, I do the prescription, send it off to someone that I trust, and then, you come back, we place it in the mouth, we do our excursions, meaning the movements of teeth, side to side, all of that, and then ask you to come back again after 2 weeks if needed, and do the follow-ups versus you just going out there and making one of those that they put, they have a template, you put in the warm water. I'm sure that it's not balanced properly, and long-term, there's no follow-up, and you might create more symptoms for yourself by doing that, because it's all about muscle relaxation. So the bite is very important, to have the evenness and no premature contacts anywhere. And really, the honest truth is the only way to capture this is by doing it customized in the dental clinic. So night guards cover the teeth and separate upper and lower teeth, protecting them from damage by the heavy forces and friction of bruxism, which is the official term for clenching and grinding. Night guards prevent the jaw muscles from fully contracting and therefore reduce the amount of force or pressure they can produce. Night guards decompress the jaw joints and protect the TMJ from the damage of bruxism. And night guards act as a retainer for the teeth they cover and prevent them from relapsing into a formerly crooked position. So that means they actually act as a retainer. But if you have a retainer, I've always said this to patients, such as myself, I wear my night guard 5 nights a week. And then the other 2 nights, I put on my ortho aligners, retainers, just so I know I've got both of them in there. And this really reassures that our teeth don't relapse. How do I know if I clench or grind my teeth? That's a very good question. Many people suffer from symptoms of bruxism, so they know they clench or grind while they are sleeping. These symptoms may include headaches or facial pain upon waking, a feeling of tightness or muscle tension in the jaws, generalized sensitivity of the teeth, or pain in the joints. Others are heavily clenching or grinding without having any idea that they are doing so. And I see this. This is both good and bad. Obviously, it is good not to suffer from the symptoms, but it is bad because it may allow you to miss a problem. The good news is that if you do clench or grind your teeth, it will leave visible evidence inside the mouth that we are able to spot. If you are not sure whether you clench or grind your teeth, ask at your next visit. We look for the following signs: flattening or shortening of the teeth from friction, called attrition; notching in the teeth near the gums, called abfraction; generalized gum recession; a white callous line inside the cheeks at the level of the teeth, called a linea alba; scalloping of the sides of the tongue where it touches the inside of the teeth, sometimes referred to as a pie crust tongue; enlarged muscles in the cheeks and temples. So why are your veneers at risk? The heavy forces of bruxism can damage natural teeth, causes shortening or flattening, chipping, and fractures. Porcelain veneers are at a particularly high risk for damage from clenching and grinding for several reasons. So should I wear a night guard if I have veneers? That's the big question. The bottom line is a big yes. You should wear a night guard if you have veneers. You have invested a significant amount of time, effort, and money in your new smile. Just as you must brush and floss the teeth with veneers to protect them against cavities and gum disease, you should also wear a night guard to protect them against bruxism. The simple and relatively inexpensive dental appliance can save you thousands in veneer repairs, as well as a lot of time in the dental chair. Now, I recently treated a full mouth rehabilitation case for a very heavy grinder that had lost her vertical dimension and had severe sensitivity on chewing. So I'll give you a brief about the treatment process that I went through with her. She needed crowns and tabletops to restore her back teeth and veneers to restore her chipped, shortened, and fractured front teeth. We started by placing temporary composite tabletops on her back molars and premolars, and I gave it about 6 weeks' time to see if her muscles would adjust to the 2 millimeter opening we had given her, because that was roughly the amount that she had lost over the years from grinding. After her positive feedback, we went forward with the permanent crowns and porcelain tabletops for her back molars and premolars, depending on her existing restorations. So it was upon what she had that I decided whether we're going to do crowns or whether we do tabletops, which is just a cover on top of the teeth that restores it back to the anatomy that we had when the tooth initially grew out. Once we knew her bite was perfect, I went ahead and replaced her old veneers with new feldspathic veneers. Of course, at the end, not forgetting to have her wear a night guard for life, for maintenance. I am very pleased to be able to share with you guys today the testimonial of this patient that really lights upon the fact that how happy she is now at the end. And during the process, it was a journey, as she put it. But she brought upon the fact that there was a lot of teamwork, and teamwork has been my lifelong dream. And of course, you know, if you really love what you do and you're passionate about it, you put your all. And none of us can do it 100% as humans, but we try to be as close as we can to, you know, really doing it with our full heart and getting the results that we get. So I'm very proud of this case, if I could say that. So please have a listen.
It was a lovely journey. I knew I was in good hands. Everything went smooth. Everything went according to whatever we had planned to. Nothing, there was no complication. And I think that's because everybody is so involved and there's such a teamwork together. And everybody just gets everybody's opinion and they build this where you feel confident that you're in good hands. I remember I would open my eyes and I would see like 10 eyes on me. And filming and camera, it came to a point where every dentist appointment I could see my teeth improving and looking good and my smile coming back. And Leila was amazing. How she noticed how I was grinding and fixing my back teeth. And when I wanted to do the colors with the veneer, Iham, he was very patient, and we did a couple of appointments just to get the teeth color right. I feel confident now. I can smile. I can be myself. Well, I had a good smile. It's just my teeth were worn out by grinding, and I have natural teeth now. She's a perfectionist, and I like her bedside manners. I like her how she gives you her attention, full attention. You know, she knows what she's doing, and that's what makes you confident to go ahead and do what I did with Dr. Leila. Thank you so much, and I hope I wasn't. I hope I was a good patient, and everything worked out thanks to you, and thanks to your team from Leila's Hariri's Dental Clinic.
As always, any further questions and concerns about your teeth, please follow us on the social media, Leila Hariri Dental Clinic. And don't forget to ask Dr. Leila. Thank you all for listening, and talk to you all next time.